The reason to bury a knot is so that there is no knot visible from the surface, but the skin edges are well opposed. Generally, you will only need to bury a knot when closing skin. To bury a knot, take the first bite in the deep part of the incision. This is where the knot will be, so be sure to be deep enough. Bring this bite out superficially. You want to come out just below the epithelial layers. Next, move across the incision and enter superficially at the exact same depth you came out of on the other side. Exit this bite in the deep aspect of the tissue directly across from where you originally started. In order to keep the knot as small as possible, avoid surgeon's knots when trying to bury a knot, and use only 4 throws or 2 square knots. To facilitate the knot burying under the skin, pull the suture with steady horizontal pressure parallel to the incision. Watch as additional buried simple interrupted knots are placed. One important concept is that both ends of the suture should be on the same side of the loop. If you tie over the superficial loop, the knot will not bury appropriately. Both ends of the suture should be on the same side of the loop. A subcuticular or intradermal suture pattern is used to close the skin with no suture visible from the outside. Careful and exact apposition of the epidermis is the goal of this suture pattern. Begin with a buried interrupted suture. As we described, this is placed in the vertical plane, starting and ending in the deep tissues. After you bury this knot, switch to taking suture bites in the horizontal plane, with all bites taken in the superficial tissue just below the epidermis. You may need to oversew your starting knot. To do that, take your first bite just behind your knot at the commissure of the incision. The next bite should go in just behind or exactly where the last bite came out on the opposite side of the incision. Bites should be symmetrical and enter and exit the tissue at the exact same depth to prevent stair-stepping of the closure. Work your way down the incision. With about 1 centimeter left to close, start to bury the ending knot. To bury the end knot, switch to vertical placement of sutures. From your last horizontal bite in the superficial tissues, go across the incision and take a vertical bite, entering superficially and exiting deep. Move across the incision and take another bite starting deep in the tissue and exiting superficially. The loop that is created in the deep tissue will be used to tie the knot, but if you tied it now to the superficial suture, the knot will not bury. So, take one more bite on the opposite side of the incision from the superficial tissue to the deep tissue. Now tie the deep loop to your deep suture. Notice that you will have a superficial loop of suture past where your knot should be tied. It is important to avoid tying over the superficial loop, as that will prevent your knot from burying. Avoid throwing a surgeon's knot, as it will make your knot bulky, and pull with even pressure, horizontal parallel to the incision. The final maneuver to get your knot to sink down into the incision is to cut just the loop on the knot, leaving the suture with the needle attached. Pass the needle back into the incision, directly over the knot, and between the superficial loops of suture. Exit the needle lateral to the incision and pull the suture tight. You will feel a slight pop as the knot flips around deep in the tissue. Continue to apply tension and cut the suture at the level of the skin.